justify as how India is pharmacy of the world. We know very well, friend, that India is supplying 40% demand of medicine to US and 25% total demand of UK. And apart from that, India is the only country in the world supplying 20% total demand of the medicine of the world. Indian pharmaceutical industry providing 60% vaccines of total demand of the world. HIV is a very big issue till today, because after 50 years of introduction of HIV into this world, we are not able to develop vaccine. But I'm just giving you one fact. The cost of HIV or AIDS treatment has gone down to $400, and earlier it was $12,000 per year. It is because of the Indian pharmaceutical industry. Because Indian pharmaceutical industry is not only a pharmacy of the world, but lifeline of the world. We'll look at the global global market of the pharmaceutical industry. According to IQVIA for human data science, the global market size was 1200 in 2018 and growing by 4.4 to 6%. Means by taking 5% average growth rate, it grows to 1260 billion in 2019. And by 2020 it would be 1323 billion. Means the global pharma market size would be the 1323 billion. We should look at the Indian pharmaceutical industry as the Indian pharmaceutical industry growing by 11% and going to touch 41.9 billion in 2020. So global market share is the global market share of Indian pharmaceutical industry is 3.3% as of now 2020, and Indian pharmaceutical industry is the third largest earner of foreign currency. So it is a boon for the India. There are 19 special economic zones for pharma sectors across India. So it's big thanks to the government right now. And India is home to about more than 12,000 drug manufacturers. Indian pharmaceutical industry providing approximately 10 million jobs directly or indirectly is a big boon. And when we talk about the e-pharmacy, so global e-pharmacy market size is right now 51.8 billion in 2020 and growing by 14.8%. But in India, it is not legally allowed. But we look at the market size and the growth rate. So e-pharmacy market size in India is approximately $1.3 billion as of now 2020 and growing by 63%. So once the government will legalize retail pharmacy, online pharmacy, then it's going to give not only to the boost to the pharmaceutical industry, but also will generate maximum number of employment. There is a question, why North America and Germany dominates in e-pharmacy, why not India? Because India should take that place, because India is 20% supplier of the global demand of the world. So if the moment will legalize retail pharmacy, we can move towards the share of North America and the Germany very easily, because we have the ready products available out here. When we look at the AICTE, total approved pharmacy colleges in India is 49,561. And the total registered pharmacists are approximately 1 million out here. And India has maximum USFDA approved plant after USA. I have one question. How US holds 45% share of the global pharma market? Because of the one reason, they are concentrated on one point, is the innovation. So the moment we will take care of the innovation, and then we'll start growing from 3.3% to the maximum number. Second question, how USA is number 1 in API and China is number 2 and India is number 3? Again the same question. America believe in innovation, and India and China believe in being a followers of America. So the moment we'll convert ourselves from followers to leader, then the things will change. Okay. Third question is, how can India touch 100 billion by 2025? Yes, it's possible. We can touch 100 billion, but we have to concentrate on the API production as well. We have to be self-reliant on the API production as well. Right now, we are very much into the generic manufacturing, and apart from the API production, we have to have the concentration on innovation. So when India would be self-reliant on API. See, I have surveyed in Pharma Group and the other manufacturers, on more than 1200 manufacturers. What are the um, uh, time period that we can achieve the manufacturing of API, and we can be a self-reliant API in API production as well. So the conclusion is that within a year or maximum in 5 years, we can achieve the self-reliant status. And the most important thing, the government has to come forward with the facilities like free land facilities, free electricity facilities, financial support. The most important thing, we means the manufacturing industry of API couldn't grow because of the government restriction. Government are very much not targeted about the expansion of the API. They were not issuing in the NOC, and for environment, NOC is very mandatory in case of API because it can cause the pollution. So because of the lack of the government initiative, Indian pharmaceutical industry, especially the API, are behind of China because of the Indian government, not the Indian pharmaceutical manufacturers. So Indian government has to come up in a big way with the vision and with the support and with the commitment and with the motivation in association with the Indian pharmaceutical industry. Then API production, then we can be in self-reliant in API production as well. What do we expect from government right now? Simple, we expect government should join hands together with the industry people, and they should give everything the timeline. Like for example, the manufacturer establish the manufacturing unit. There should be a timeline how soon they can get the approval of manufacturing and the product permissions and NOC for the environment and everything like electricity facilities, economical one or the free, and the financial support and all. These are the very mandatory kind of thing. We have to be planned like a family. Then only we can touch upon the we can be a self-reliant country on API. And when we look at the China and India, why China is very much economical and more affordable when we talk about the API right now. Even the moment we manufacture API out here, we cannot sell within India in a better way because our production cost is huge in comparison to China. Why? China has connection and association and sharing borders with the 14 countries of the world, whereas India is sharing countries with 7 of the world only right now. And I will just give you an idea about the border sharing. China is sharing border with North Korea, Russia, Mongolia, Kazakhstan, Kyrgyzstan, Tajikistan, Afghanistan, Pakistan, India, Nepal, Bhutan, Myanmar, Laos, and Vietnam. And this is the reason they are providing they are having the benefit and USP of transportation. They are very economical in transportation of APIs across the world. Our transportation cost is very costly, and this is the one reason. And second reason that China has a good amount of orders, so they run their factory 24 hours, and we are not running the factories 24 hours. One shift is more than sufficient. And apart from that, China is having good facilities of chemicals, APIs, excipients, and other ingredients within the China, and we are not having that facility in India. We have to look on that factor as well. We have to have the vision. Vision means how soon we can achieve the API self-reliant status. It is very very in need of the hour. We are planning to war, or even China is planning to war with the India, but our war is not only for land, but we have a very big war for the self-reliant on the API, and we cannot stop our production. India is the superpower in manufacturing pharmaceutical formulations right now, and the moment we will be having simultaneously the API production side by side, then we can fulfill the commitment of the orders across the world, and we can supply without any deviation of the commitment. And without government policy, it is not possible, and we cannot wait. We face lots of situation in the COVID-19, and India stand by the global community, and we supplied medicine across the world even without thinking that our staff can be infected, and few staff got the coronavirus infection and then they died because of working during the lockdown. Thank you very much. You share your feedback, your query, and please like this video, subscribe this video, and share as much as possible. And we'll come very soon with the next topic in the pharmacy of the world. Pharmacy of the world is now going to be episode or series for pharma industry, and we'll conduct more interviews of the pharmaceutical manufacturers, exporters, regulators, and the stakeholders in days to come.